What should I know when first diagnosed with CLL?
At the time of diagnosis of chronic lymphocytic leukemia, I know it's sometimes very difficult to keep up with the information that the physician are providing during the appointment. So the main message is that the disease follows an indolent clinical course, so in some cases never require treatment, and we should not hurry to start treatment at the time of a diagnosis unless there are specific signs or symptoms associated with active disease. These signs or symptoms of active disease are usually detected through physical exam to identify the presence of enlarged lymph nodes and imaging studies like abdominal ultrasound and lab tests, including basically complete blood cell count. We do not worry about the number of white blood cell count, so this is the way we are diagnosing chronic lymphocytic leukemia, but it's not the way the disease is harming the patient. So no worries, even if the white blood cell count increases over time. The focus is the value of hemoglobin, because if the value of hemoglobin drop down, the patient can experience anemia, and anemia may be associated with symptoms, and the platelet value, because the platelet values drops down, there is an increased risk of bleeding. If this value remain normal, or even if not normal, they are only slightly decreased, there is no need to start treatment. The patient should be followed on a regular basis. So the most relevant information we provide during our first appointment is usually that the disease do not always require treatment. If it requires treatment, there are new targeted agents available and very effective and well-tolerated treatment strategies. The most important, health instructions we provide the patient with are to, of course, follow a healthy lifestyle, get vaccinated for disease where active vaccines are available, including flu shot, SARS-CoV-2 vaccination, pneumococcal vaccination. These are all important way to prevent infection, because in this disease there is a higher risk of infection. And also we recommend an annual dermatologic checkup, because the disease is favoring the occurrence of skin tumors that are easily identified with a regular checkup and removed in the outpatient clinic without long-term consequences. So they should be identified early in order to be managed in the best way.
So that's why I like to say it's a cancer of the immune system, because it is a cancer. But at the same time, it's critical to understand that it's a cancer that can behave very differently. It's a chronic disease. And patients think, oh my God, can I cure this? And my typical reply is, we don't cure diabetes. We don't cure high blood pressure. Once you're diagnosed, sometimes with diabetes, you may just adjust your diet. Sometimes you may need pills. Sometimes you need insulin. Sometimes you need a pancreas transplant. But it's a chronic disease that you're going to be living with it. And in the great majority of times, we don't need treatment right away. So as we talked before, sometimes you detect it, but when you look back, it actually had been present for quite a while already. So in most patients, you do not need treatment right away. And we know that we have criteria to treat. So we have beautiful therapies that work extremely well, but we know that if you don't have indications for treatment, and basically if you have symptoms from the disease, we'll treat it. There's no reason to leave symptoms if we have treatments available. But on the other hand, if you don't have symptoms, we have criteria to treat asymptomatic disease. But mostly what happens is if we find it, it's not giving you trouble, we'll watch it. We won't even treat it.
From diagnosis, there's a period of, as I mentioned before, these are not aggressive lymphoma. We call them indolent lymphoma. There can be a period that can be very heterogeneous. It can vary from patient to patient, but in general, there's a period that patients do not require treatment, and it's our observation. And the number of these cells in your blood doesn't necessarily determine that patients will require treatment until they meet this criteria by IWCLL. That's what we call. At the time of treatment, what I usually tell my patients that the treatment has changed since I was in fellowship. And largely, there's less and less to almost no role of chemotherapy at the moment because of the new drugs are available to treat these disorders, to the point that we can get very deep level of responses. And right now, actually, time-limited therapy where we treat patients for a year or 2 years, depending on the setting. And after that, we just stop treatment and continue watching patients. So the traditional chemotherapeutic agents are less favored, such as those are requiring infusions and that patients develop, the traditional pictures that people think, losing their hair, nausea and vomiting. Right now, the treatments are more targeted. There's has been, very good knowledge in the last few years, especially how these cells act. And novel therapeutic agents are called proton tyrosine kinase inhibitors. They have revolutionized the treatment of CLL. So as I mentioned before, CLLs are B cells. So there's something called the B cell receptor that promotes the signaling towards the cell that lead them to increase proliferation and survival. So now we use medications that specifically target certain pathway areas on the B cell receptor signaling that make these cells, stop proliferating. And these are typically pills that patient takes. There's also monoclonal antibodies. These cells in their surface, they have a marker called CD20, and now we have antibodies directed against this marker that we use it in combination with different agents, and we're able to control this proliferation of cells very successfully. The new agents are more targeted rather than using a chemotherapeutic approach, which is kind of killing good cells and bad cells. That doesn't mean that the new agents are devoid of any side effects, but based on the recent results of data, in comparison to traditional chemotherapy, these agents appear to be more favorable, useful, and better.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.